Hi, I'm Dr. Nicole Vane, and I wanted to take a moment to review what the supplements are when we are doing a surgery. So when there's a surgical extraction, if you've watched any of the other videos on why tooth removal is important to have it done correctly, we're cleaning out all the infection. And yes, we're going to be using ozone to clean the infection and ideally Procaine to help break the inflammatory cycle. But there's a couple supplements that are really critical to aid in proper healing, especially to aid in healing without the additional use of antibiotics or pain medication. So the PRF, the use of your own blood and stem cells in the socket, is critical. But also, there's a couple we recommend. So the first and the most important is D3K2. I've gone in other videos about the importance of these two vitamins, fat-soluble vitamins, and how much we're lacking in our modern-day society. In tribal cultures and in many old-fashioned cultures in other countries, we still get a lot of organ meat that would give us some of these D3 and K2, as well as fresh dairy when it's unpasteurized. So we're all missing this, and this is what's critical in stitching the bone and getting it to fill in well, because PRF doesn't include packing the bone or packing the socket with any artificial bone. It is just your own stem cells. So in order to help those function best, D3K2 is very important. The second one I like that I've found is wonderful for surgery also involving frenectomies or gum surgery, as well as a tooth removal, is this Injury Rescue. I also have the separate vials of homeopathics, but this is nice because if you're sore especially, or you don't like the feeling of those little homeopathic pills dissolving in your mouth, then this is just a nice little tincture that you can put below your tongue. It has arnica, which is critical for inflammation, Heparin sulf, ruta, and symphytum, which are critical for getting the bone to stitch. Heparin sulf is also really good for getting the inflammation to go down and also decreasing pain signals. There's a lot of times a little bit of chamomilla in here, which helps with tooth pain. And then also it's important to have the factors that help guide your body towards healing. So if you don't believe in homeopathy, there are other options, but I really do. I found this to be tremendously effective to the point where after surgeries, I haven't needed to take even Advil. I just take the injury drops, and I also additionally supplement with arnica, either 1X30C or 200, which I'll go over with you depending on what's best for your needs. And also this one's good for any ages. So if we have a child tongue release or an adult surgery, we can dose accordingly. If there's infection present, I like to use this bacterial remedy. Again, I have other videos on how bad antibiotics are for your system, so I only use them when 100% necessary. Now, not everyone needs this. A lot of times I'll just get the ozone in there and feel like I've really gotten the infection removed. But if I feel I haven't, or I'm concerned about swelling or unresolved pain, then I would recommend this bacterial infection. The Lympho-Nest or Lymphomyosat is really critical for people that have swelling. This helps clear it from your lymph system, your lymphatic drainage system, and from your lymph nodes. So sometimes people after a surgery they feel like their nodes are really tender, and this will really help clear that out of the lymphatic system. This is especially important for Lyme patients to help clear it. They have a harder time removing bugs from their system. So this is my cocktail for surgery.